And so I think last question for Mike and Erica, where do you see the SECURE-IBD registry going from here? You've sort of said a little bit about it, but what's your next big step, do you think?
So it's my hope that as more cases accumulate and as we acquire more data, we'll be able to more specifically identify the medications that might be associated with either a higher risk of worse outcomes with COVID or potentially a protective risk, because not only have we asked providers to tell us what medicines their patients are taking, but we're also asking about dosing and frequency of medicines and a lot of really specific information about those medicines. So as we have more data, then I hope we'll be able to provide a little bit more specific information about which medicines may be safer and which medicines may be less safe. So I think that would be sort of on the horizon, one thing that I'm thinking about.
And the other is sort of secure version 2, and our group and others have already been sort of doing some early planning for, what happens after this passes? Do patients develop antibodies against coronavirus? Are those antibodies protective? What are the factors that make one patient more likely or less likely to develop long-standing immunologic protection against coronavirus or something like that. And what are the long-term disabilities, if any, that the patients have after the recovery phase, and are IBD patients more or less likely to have long-lasting effects from this?
Yeah, no, that's great. And I think with that, we'll wrap up. We're right at 8:30. So maybe thank you very much again, Mike and Erica, for joining us. We really appreciate it. The work you're doing is very, very highly valued. And you both, as healthcare workers, we're thanking you, but in particular about, this project that you've helped develop is outstanding. And I think the community, the Crohn's and colitis community, truly appreciate it.
Well, thank you again for having us.
Thank you so much.